Sometimes people will take a probiotic and they feel worse before they feel better, right? They're like, oh, my gut doesn't feel as good. That's actually a good thing a lot of times.
You're listening to the Digest This podcast, and I'm your host, Bethany Cameron. If you suffer with asthma, allergies, chronic coughs around smoke, pollution, heck, if you have gut issues, this episode will blow your mind. I bet you didn't know that our gut health affects our lung health and vice versa. But I mean, it does make sense because if our gut health affects our brain, our skin, and our mouth, why wouldn't it also affect our lungs? In fact, our lungs require certain probiotics that our gut does not. And so that is what we are talking about today. How to support our lungs by supporting our gut with specific probiotics, GLP-1 supporting products as well. No, I didn't say GLP-1 products like Ozempic. No. These are products that naturally support GLP-1 our bodies naturally produce without any side effects. I have Kara from ResBiotic joining me today to help shed light on the lungs, our gut, weight management, and their connection. I also want to let you know if you guys are interested in ResBiotic, at the end of this episode, I do offer a code, which I will also offer here at the beginning. The discount is Digest This, and that will get you a discount off of ResBiotic products. Again, the code is Digest This. Okay, Kara, so I am so excited to dive into this interview because gut health and lung health, I never would have thought that those are connected and so deeply connected. And I'm sure everyone is like, wait, your lungs are connected to your gut health? So like, how could that be? So first of all, I have a couple of questions, and maybe you can just say yes or no. I like to always pique my listeners' interests, and then we can dive in after the fact. Are you ready?
Sounds great.
Okay, yes or no questions. First question. Well, I already established that there's a connection between our gut microbiome and our lungs, correct? Is that
Yes.
true? Okay. And can exercise help our gut microbiome?
Yes.
And do lungs have a microbiome?
Yes.
This is crazy. Do our lungs need probiotics to thrive?
Yes. But there's
a
some more,
caveat to that?
I was going to say, there's some more explanation to that. So hopefully we can dive into that.
Yeah, for sure. Okay. And then I'm trying to think of like I have so many questions, but like yes or no. I just want to dive in. Okay. So I'm just on the edge of my seat here. Why don't you introduce yourself first of all and tell people who you are and what you do?
Yeah. Thanks so much for having me. So my name's Kara. I'm a registered dietitian and came up through very much the conventional space, worked in hospital, inpatient, outpatient, ICU, ran a diabetes program, and then found myself working in gastroenterology practice and started building a functional nutrition practice for them and spent 10 years. And it really just kind of jump-started this love of the microbiome and how important it is that we have to consider the microbiome when talking about our health. And so that jump-started my career into biotech and working for various microbiome companies. And I've been with ResBiotic now, managing their healthcare practitioner channel and working on partnerships really to get our education and our science and our products out there, because we do something different than what's traditionally done in the supplement space. And I'm excited to talk about that. And it goes back to our founder and really how he kind of envisioned this company of being a science-first company.
Yeah, I can't wait to get into that and what ResBiotic is. But I first want to distinguish, so what is the gut-lung axis exactly?
So I think before we get into the gut-lung axis, we have to really understand what the microbiome is. And if anyone's ever talked to me or my patients or anybody I've ever spoken to, I really think of the microbiome as the foundation. So think of a house, right? You find this big, beautiful house that has everything you've ever wanted. And we wait very patiently for that inspection report to come back to make sure that our foundation is good, right? Because if there's cracks in that foundation, then our house isn't going to be as resilient or stable. That's exactly what the microbiome is. It's truly the foundation to the rest of the body. We like to think of it as the control center, the gateway to the rest of the body, because what's happening there is not just impacting the gut, it's impacting everything beyond. And it's something at ResBiotic that we've coined as the term the gut X axis. So if we have dysfunction, if we have imbalance within the gut microbiome, those trillions of bacteria, all these different bugs that live harmoniously with us that are really controlling everything from our immune health to obviously our digestion and absorption of nutrients to keeping those bad guys away. I say, we don't want those bad neighbors moving in next door to us, keeping our neighborhood, very healthy and thriving. If there's dysfunction within that balance, then we start to impact the resiliency beyond. And we know that compounds and components from the gut can find their way into other parts of the body and essentially drive inflammatory responses, drive changes to the immune system. And that's what's felt so much beyond the gut. So the gut-lung axis is basically the bidirectional communication or this network of what's happening in the gut impacting what's happening in the lungs and what's happening in the lungs impacting within the gut. And so we now know that it's important that we have to not just maintain balance in one, but we want to support the other and maintain balance. Again, vice versa.
Yeah. Okay. So that was my question. So if you have an impaired gut, that's affecting your lungs, right? But what if your lungs are impaired? Can that affect your gut, or is it only one way here?
Nope. So if we are dealing with lung conditions, say, for example, asthma, we know that people with asthma often have GI conditions, often have GI symptoms. And so what the research has really looked at is that people that suffer from lung dysfunction or lung conditions actually have dysbiosis or imbalance within the gut. And so it's not necessarily, we call it like the chicken or the egg, but obviously there's other things that impact our lung function from genetics to environment. And so we're seeing people that have diagnosed lung conditions have changes and specific signatures in their gut that's more related to having inflammation and inflammatory or altered immune responses.
Okay. Well, and I don't know if you know this, my followers do, but we unfortunately discovered that I have mold in my lungs. And so I've been going through treatment for that. And I have a history of gut issues, right? Thankfully, my gut is so much better now. But we recently, of course, discovered the whole lung situation. And I have no idea how I got mold in my lungs. I could have had it from childhood. And my thought is just even talking to you is perhaps I could have caught this mold when my gut was critically impaired like 10 years ago and I just didn't know it.
It's hard to, right? Like that chicken or the egg, like what's causing one is affecting the other and what's happening in the other is impacting the other, right? And that's what's hard. But think about it. We take more than 20,000 breaths a day. And I've heard my CEO, Dr. Lal, who founded the company, he says, we only eat 3 times a day. So the air we're breathing, things that are coming in, they're not just passing through our lungs, but they're impacting what's going on beyond that too. So from a mold standpoint, mold we know can affect the gut. We can get mold from food. We can bring it in. It's around us. But if you have at baseline a dysfunctional gut microbiome at the time when you're exposed to these things, then we've lost resiliency to the rest of the body. And that's why I think of the microbiome as the foundation, just like the house, right? You can have everything you want in your house, but if you got cracks in that foundation, when that hurricane comes through, your house might not be able to withstand that.
Yeah. And I think it's really important for people just to really know that one affects the other. So the health of one can influence the other. And that's why I feel like lung health is so important because it does affect your gut health and obviously vice versa. So I want to say, I asked you about the gut, the lungs and having a microbiome, and that totally makes sense because we have an oral microbiome. Yep. We have a vaginal microbiome. Our skin has a microbiome. So it's like, okay, duh. So what can impair the lungs? Obviously smoking, right? But beyond that, beyond the typical, what can impair the lungs?
Well, so obviously think of, air quality, right? Even just most recently, like all the fires that happened. That is one of the biggest things that, we're living in areas that don't have great air quality. And so we know that that can create not just dysfunction in the lungs, but that can even create dysfunction within the microbiome. Because, right, we're breathing these things and they have to get processed and worked through. So, so the air we're breathing obviously is a big one. I mean, think of like a lot of the environmental toxins that we can be exposed to, different scents and smells, anything that we're potentially taking in. And so all of these things have impact. And I don't want to be like fear factor here, like, oh my God, I wear perfume, like that could be damaging my lungs. But these things are filling up the bucket. And so I think it comes back to what can we do to support the function that's happening in the lungs, as well as support the microbiome, which is a big player in how our lungs function and how well our lungs function. So that's why when we look at what we can do through modulation or modification of the gut microbiome, these very precision and targeted, say, probiotic strains, what we're working on, one of our products at ResBiotic, is to use the microbiome to influence inflammation in other parts of the body, and specifically with our lung probiotic, the lungs. And so it's not to be like, oh my God, I can't go outside and breathe air, I need to wear a mask or something, because these things are natural. It's building that resiliency so we're not as impacted by it.
Yeah. And you mentioned, so ResBiotic is a probiotic for your lungs, right?
Yep. So one of the products that we make, and one of the first products that came out, is our ResB Lung Support Probiotic. And what's so unique about this, and what's exciting about the microbiome space, and I've been working in the microbiome and GI space for a while, is with advancements in technology and the ability to actually really understand and intricately study these probiotic strains, we're better able to understand their functions. And so we have 3 respiratory specific strains, lactobacillus strains, that target the function of our lungs and improve the function of our lungs and improve respiratory health. And then we combine in our ResB Lung Support Probiotic 3 botanicals. We have holy basil, Visaka, and turmeric, which are Ayurvedic herbs and really potent antioxidants, and actually have lung supporting mechanisms as well. And what's really unique that we've done is we've not just studied strain specificity to see that these strains are specifically targeting the lungs and improving that through the microbiome, but we've actually studied the product together, which is really unique. So it's one thing if you understand the mechanisms behind each of these individual ingredients, what happens when you put them into the capsule, what happens when you take them. And so we've done actually more than 3 we've done more than 3 clinical trials on these products to show improvements to lung function, to show increased gut metabolites that are beneficial, what's known as short chain fatty acids. We've seen improvements in mucus production. And so it's really exciting, again, that we can support the lungs through modulation or through supporting this gut lung axis.
Yeah, well, you mentioned short chain fatty acids, and I wanted to get into that because, to my understanding, so short chain fatty acids are produced by gut bacteria, and they are crucial for lung health. And can we just take a short chain fatty acid, or is it our body actually produces them, right?
So great question. And short chain fatty acids have profound impacts. I mean, not just on lung health, but everything from metabolism to brain health to obviously gut health. And so short chain fatty acids are produced from our prebiotic fibers, or what we also call microbiota accessible carbohydrates. So these really, potent fibers that feed our good bacteria. And so not all fibers are prebiotics. These are very specific types of fibers, your resistant starches. Think of your fructooligosaccharides like your onions and your garlic. So I know you mentioned you've dealt with a lot of GI issues. You might have had experience with your FODMAPs. FODMAPs are microbiota accessible carbohydrates because they get fermented by our beneficial gut bacteria. And that end product of fermentation are short chain fatty acids. And butyrate, which is the sort of primary short chain fatty acid that fuels the colonocytes, so the cells within the colon. These have profound, impact beyond the gut, but butyrate in particular has very potent antioxidant, anti-inflammatory, and immune supporting benefits. Oh, go ahead.
Oh, butyrate, that's considered a quote postbiotic.
Yep.
Right?
So that is exactly what I was getting to. So some of these end products, the end product of fermentation, so butyrate, postbiotic, because it's what's produced by our beneficial bacteria, you can take as supplements and have, really great benefits, but they're targeted, right? And so I always say, like, I used butyrate all the time with a lot of my ulcerative colitis or patients that were having a lot of diarrhea because we wanted that targeted benefit. But we also want to support the microbiome and support the bacteria that produce butyrate, because then you're supporting the survival and thriving of the beneficial bacteria within the gut microbiome. So you can take short chain fatty, you can take butyrate, but you can also focus on the diet. You can also take prebiotics that's helping to produce butyrate, helping to support the growth and survival of your beneficial bacteria that help to support the GI environment. And so not to say one over the other, but we want to obviously do what's helping to promote the health of the gut microbiome. And so
Well, I'm thinking of it, it's like a trio, right? Like everyone knows what probiotics are now, that probiotics are the good bacteria, and people are pretty aware of what prebiotics are. That's the food for the good bacteria. And then postbiotics, I always think of postbiotics as like the poop that they excrete, basically, but I hate to say that.
I mean, it is. It's a couple of things, right? It's basically that butyrate, which is kind of the primary postbiotic that I think we often think of when we hear the term postbiotics. But it's what bacteria produce or compounds or components that are within that bacteria, contained on that bacteria, that have metabolic activity. So when bacteria, so for example, postbiotics can be a dead bacteria. So we actually produce a postbiotic at ResBiotic, and it's not butyrate, but it's a bacteria that's been freeze dried. So it's basically dead, but it's retained some metabolic function. So it's very targeted. And so one of the postbiotics that we use is actually targeted to support the production of GLP-1. But there are other postbiotics, say, that bind to C. diff or postbiotics, but these are dead bacteria that have retained some beneficial components. So you're actually so you'll see it named as the bacteria, but it's not alive, right? It's not feeding on the food that's coming in, and it has a very targeted or specific function.
Okay. And I want to ask, for those listening, could we just like go anywhere and get any probiotic and think that it's going to support our lungs, or what is specific for the lungs?
That's a great question. So no, and I think that's what's really exciting about the microbiome space now, is that we have these targeted strains that have very specific functions. So in our ResB Lung Support Probiotic, we have 3 different lactobacillus strains. And so we have an L. plantarum, and an L. acidophilus, and then an L. rhamnosus. And so many people will say, oh, lactobacillus acidophilus, that's in this or this, but those specific letters or names that come after that. So we have a lactobacillus acidophilus RSB12. So that's our strain that we've developed, that we've done research on to figure out that functionality and what it's targeting. And so that strain in particular is targeting the lung function. So those 3 strains that we have together are 3 respiratory specific strains. So I think that's kind of the movement that we're really seeing in the microbiome space. Is kind of gone are the days of the general probiotic. I was just having this conversation with someone. We're really moving more into targeted and precision therapy, because we can actually study the functions of what are these strains doing? What are these bugs actually, what are they actually targeting in the body?
Yeah. And I think you bring up a really good point, because everything does have a specific strain that your body needs. I know I was talking with someone else, and she was talking about the vaginal microbiome.
Yep.
It's like, that's a totally different thing than your gut or your skin or your mouth. And so to your point, the lungs. And I kind of want to rewind a little bit. And I still want to know, because I'm such a nerd, how does the gut and lung actually communicate with each other through various mechanisms?
So similar to the sort of gut-brain axis, 90% or, most of the signaling is happening gut to lung. So I just want to preface that.
Okay.
It's not equal, right? And a similar thing, like gut to brain is 90% of signaling, brain to gut is about 10. And so majority of the signaling is actually happening from your gut to the lungs. But like I was mentioning before, if you suffer from lung disorders like COPD or asthma, or you've, smoke, or you have a history of smoking, because that's impacting obviously the health of the lungs, we also see these people having specific microbiome signatures. So signatures in their microbiome that are characterized by having greater, for example, proteobacteria. So for anyone who's ever done stool testing, proteobacteria are bacteria that it's the phyla, so like the big sort of group of bacteria, but the most pathogens are contained within that phylum. And they contain certain components on the type of bacteria that they are, what's known as lipopolysaccharides, LPSs. LPSs are part of bacteria or gram-negative bacteria, but they can become very inflammatory and can really begin to wreak havoc on the immune system when there's imbalance or dysbiosis within the gut microbiome. And those LPSs can get into systemic circulation, so can get into your bloodstream and travel to the lungs and cause more inflammation or more immune changes to take place.
Okay.
So that's a lot. And so people that have asthma or COPD have greater amounts of these more harmful or more negative, types of bacteria. So you're kind of perpetuating and precipitating that inflammation and immune changes to take place. But if you have changes in the gut and you have dysbiosis and we're eating a poor diet and we're stressed and we take a lot of antibiotics, all these external inputs that can impact the health of the gut microbiome, that starts to break down the gut barrier. It starts to break down that security perimeter that protects our microbiome from our immune system, what's known as that mucosal barrier. And as that breaks down, well, now harmful bacteria or components of bacteria like those lipopolysaccharides can get into systemic circulation, start to increase inflammation throughout the body. So
Okay.
it's kind of like a vicious cycle sometimes, as I like to think of it.
Yeah, well, and I feel like a lot of my listeners are pretty familiar with, like you said, the gut-brain axis. And I've experienced this, and I'm sure you have. It's like you have brain fog, and then after you have a good bowel movement, like your brain fog immediately goes away.
Yeah.
And so to your
Absolutely.
point with the lungs, and I want to ask, so what are some signs, obviously asthma, but what are some other signs that you maybe have an impaired lung?
Well, and so think about I even think about a good example. Like I'll just use an example of recently. I have a young daughter, and she brings home lots of germs and colds. And I caught one recently, and a lot of my colds end up in my lung. Like I always get a cough after a cold, and I have healthy lung function. I'm an avid exerciser, right? All those things, but it always ends up in my lungs. And so I started taking our ResB lung support probiotic, and no joke, the last time a cold came, it didn't end up in my lungs. And so I think when we think about lung function, we have to think about, well, how do we want to optimize, what's impacting how deep of a breath we can take? Maybe it's because we live in an area that doesn't have as clean of air and we're breathing in a lot of these components or toxins that could naturally create lung dysfunction or create inflammation in the lung. Maybe we suffer from colds or we had a virus or RSV or we've experienced something that can create a little lung damage. I think of a lot of our post-COVID people. I'm doing a bunch of case studies with some practitioners on some post-COVID patients that have this lingering cough, that have this increased mucus production. I live in Colorado at altitude. So I think of, how can we optimize lung function here when we're hiking and doing things because we're in altitude? So I think there's a lot of ways that, we might think about lung health, and it might not be because we have asthma or because we have something, but, viruses, seasonal allergies, anything that can really create more mucus that we know then can drain into the lungs.
Yeah. Well, I think of my mom because whenever she gets sick, she always gets a cough,
That's me.
regardless, that's her quote weak spot.
Mm-hmm.
And I think everyone listening can be like, oh, well, I get sick. My stomach is always a wreck because my stomach is my weak spot, or my lungs or my joints or whatever. So if you get sick and you always get a cough when you get sick, that may be a sign. So that's a really good example with your daughter.
Yeah, and it's nice. So now this is something that I take because, especially going into winter season, we want to build this up. It takes time for the microbiome to change and adapt, and so it's not like, oh, I take one and I feel better. We really encourage anywhere from 60 to 90 days of trialing something. But I've been doing this now for a while, and it's been great because I've seen a change when it comes to those colds that I do get hit with.
Yeah. Well, how long does it typically take for you to see a change? Because you don't want to just start taking this when it's winter and, then you get sick a week later. You want to, like you said, build it up, right?
Yeah, it just takes, I mean, some people notice improvements. When we take a probiotic, I always say there's a couple things that can happen. Sometimes people will take a probiotic and they feel worse before they feel better, right? They're like, oh, my gut doesn't feel as good. That's actually a good thing a lot of times. Sometimes it cannot be, like, especially if you're suffering from certain gastrointestinal conditions like SIBO. But for the most part, if you start taking a probiotic and you kind of notice things going a little haywire initially, that's good because it means that, probiotics, and especially like the lactobacillus strains that we're using, they bring acidity into the gut microbiome. So it helps to push away those bad guys. It's trying to get all those guys out of the neighborhood so they don't want to live there anymore. And so as bacteria die, as that happens, we can often feel that effects. And so a lot of times when it comes to probiotics, if you start to notice that, I always say back off, start a little slower, go a little bit, start lower and go slower. But people can feel improvements, especially in the gut. Like if we are noticing some gut dysfunction pretty immediately, but I would say changes to say something like lung function, or let's say you are someone who suffers from asthma or COPD, or you have some lung condition, it can take anywhere, I would say, from 30 to 90 days to really feel meaningful changes.
Okay. And those adverse effects that you may experience, they're probably die-off symptoms.
It is. Yeah.
Yeah.
Most of the time it is die-off.
Okay.
And there's things you can do to help, kind of prevent those symptoms from happening, but that's a good thing. And that's why I say, like, sometimes when you feel that, you want that bacteria to die off. You want the opportunistic and the pathogens to not be as prevalent.
Would it be safe to take a binder at the same time to help that?
Yep. I'm a huge fan of serum bovine immunoglobulins. IgG, they're gentle and you don't have to take it away from food or other supplements because it only binds to dead and dying bacteria. So I'm a huge advocate of serum bovine immunoglobulins. They bind to lots of different things, actually, even to mold and lipopolysaccharides. But because they're specific to bacteria dying and help neutralize that effect, again, it can be taken around food. It can be taken with other supplements. We don't have to worry about that. Whereas like an activated charcoal or another type of binder, you have to take sort of away from food and supplements. Yeah, I love using serum bovine immunoglobulins and often pair it with probiotics to help prevent that die-off or that Herx reaction from taking place.
Okay, I want to ask one more time. The binders, can you serum bovine?
Serum bovine immunoglobulins, so
Okay.
IgG.
Okay.
Yeah.
Everyone take note because that's a really good tip because you don't have to take it away from food. And like you said, it can help with mold. And I'm going to look into that myself.
It's great.
Now, are there any foods that we can eat to support our lungs?
Absolutely. And diet to me is not just because I'm a dietitian, but diet is obviously what we have most control over, but it's probably the biggest factor that influences the gut microbiome and beyond. So a lot of people will say, oh, here's a microbiome friendly diet. I really just think of this as a whole health diet because food impacts us in various ways, but we know food is one of the biggest modulators or makes the most impact when it comes to the gut microbiome. And so, of course, we really want to try to emphasize lots of antioxidant containing foods, lots of polyphenols. These are all your colorful foods. So I always say we want to try to incorporate as many different colors as we can because your antioxidants are really going to provide you some of the most anti-inflammatory components. They're going to help support the immune system. And even through our spices, anything that we can add in that's really upping that antioxidant component. But also fiber. I really can't stress that enough because fiber feeds your benefit, especially those prebiotic fibers, feeds your beneficial bacteria to produce those postbiotics, those short-chain fatty acids, which help support inflammation in the gut and to the rest of the body. And so you're really eating something that's fueling the production of one of the greatest medicines that we can have from our bacteria, which are those short-chain fatty acids.
What about those people, though, that can't have a lot of fiber? Like I'm one of those people where I do not do well on a high fiber diet. I have to go kind of low.
Yep. So there's a couple things with fiber. I was just having this conversation with someone. Fiber is one of those sort of unique foods because a lot of times intolerance to fiber could be that we're just not used to it. So there's an adjustment period where your body gets used to, because again, your bacteria are fermenting them. And think about fermentation, right? Think about a kombucha when you pop open the cap, right? There's gas. And so that's exactly what they're causing. So the other side of it too is if we are struggling, like I've had so many patients say to me, my body doesn't like healthy food. Like it does better when I eat unhealthy food. a lot of times to me, as someone who's been working in the GI and microbiome space, that's a sign that we are missing some of those really important microbes that are needed to break down those fibers. So that really calls for certain types of probiotics, certain types of prebiotics that we can take to start to promote the growth. And so actually we have a prebiotic that I love at ResBiotic. It's called ResG prebiotic, energy prebiotic. It's very cool. It's a resistant potato starch. So it's actually digestively friendly. It's FODMAP friendly. So someone who's struggling with digestive issues, who can't eat a lot of those high prebiotic or high fiber containing foods, this is one that doesn't cause any gas or bloating. It has a dual action. So it actually helps to support, if we're struggling with constipation or if we're struggling with diarrhea. But because of that sort of low fermentable activity, it's not creating that gas and bloating that we would typically see with those other higher FODMAP or higher prebiotic containing foods. And then we combine it with beetroot extract, which is really cool. Beets are getting a lot of love lately, which I love. They help support nitric oxide production. So that's really good for our mitochondria, really good for stamina, circulation. But beetroots, because of that beautiful red color, contain really potent polyphenols that also support the gut microbiome. And then we actually add in methylated B12. So I have it right now as like my afternoon pickup, giving my body some energy without having more caffeine, or I love it as like a pre-workout to give that boost of energy without having any caffeine. But that's where I would often, and I have a lot of patients that say this to me, where they're like, I really can't eat a lot of fibers. I'll utilize these prebiotic supplements that are more digestively friendly, so not going to cause it, to try to bring in the components to help to feed the beneficial bacteria there, to try to change that GI environment. Because a lot of times, like I said, if we can't tolerate as many of those fibers, it's a sign that we're often missing some of those beneficial microbes that we are needing to break them
Well,
down.
I'm definitely one of those. Like for 10 years, like I've tried and I'm like, I just know now, like this fiber does not serve me. And I feel 1,000 times better when I do not eat fiber. And so I think a lot of my listeners can relate. So that's good that you have that option. Because I know like even the carnivore diet, that's huge right now. And they don't eat any fiber. And they say they feel great. And I'm like, okay.
Well, and what's interesting is there's actually been some cool studies that have come out recently, and more studies underway to look at how the carnivore diet is impacting the gut microbiome. And some of the initial studies that have come out shows that some of our very important bacteria tend to go missing, or we start to lose abundance of them. And I always say to my patients, like, I don't have people that come to see me or have come to see me and say, like, I feel amazing. I mean, like, people are coming because they have issues. And that's truly where, so if I have someone who's like, I feel much better on a carnivore diet or on a higher protein diet, we'll do a microbiome stool test. We'll do some studies and look at, and that's where supplements are really helpful. That's where giving the right prebiotic, giving the right probiotics to help restore that resiliency becomes so beneficial. But I will say, I mean, and not to like discredit anyone on it, when you look at the research and you look at what's most impactful on the health of the gut microbiome, fiber is notoriously studied. And fiber is notoriously noted because it's truly what feeds your beneficial microbes. So if we're not eating it, that's where we want to utilize prebiotic supplements. That's where our ResG, energy prebiotic is amazing because it's a digestively friendly prebiotic.
Yeah. And I think a lot of people can relate is that, at least for me, I can have fiber from fruit, but not vegetables. Like I can have a little, from vegetables, but it's like the vegetable and fruit fiber are completely different for me.
Yeah, the insoluble versus soluble.
Yeah.
Mm-hmm.
So to that point, no, I do have a question about dairy because I love yogurt, but I don't really eat other things other than yogurt when it comes to dairy. And I think it's because it's fermented.
Yeah.
And but regarding the lungs, because a lot of people say, oh, I can't have dairy, it creates phlegm, I cough up phlegm. So is dairy a no for the lungs, or what's the deal?
And this is where I work with people on an individual basis. Dairy can absolutely promote a little bit more mucus production. So for someone who does have, say, a lot of mucus, then we may want, especially if like, say, there's a lot of dairy in their diet, we may want to support it with, other types of alternatives to get some of the same nutrients. But, I'm not one to necessarily say, no, you can't have it. And that's where, again, like utilizing our ResB lung support probiotic is great because you can help support that mucus production. But I do like to look at the types of dairy we're using. I tend to encourage a lot more of that fermented dairy just because we're getting other beneficial compounds and components out of them that's nurturing, all aspects of the body. So I hate to say no to things. It might be something we take out for a short period of time while we're working on improving the health of the gut, the health of the lungs, and then we can add it back in and start to figure out that tolerance. Like, what's that threshold that I can consume that's not making me feel worse? I always say if something doesn't make us feel good, then we do need to look for better alternatives.
Yeah. And as I get older too, I have realized that not everything works for everyone. And
Individualization.
even in my own life, that what worked for me 10 years ago is not working for me anymore, or vice versa, where like I wasn't able to tolerate something and now like my body craves it. It's
Yeah,
all different.
we're constantly changing. And as we move through, especially as women, as we move through different phases of life and hormonal phases, our body is adjusting to that. I mean, menopause, perimenopause, there's not just changes in our hormones and changes in how our body detoxes, but there's changes to the gut microbiome. And so, we think about these different phases of life. And, it's like what I try to tell my daughter, like, what you didn't like last year, you might like now, right? And I think that when we listen to our body, when we turn inward and start to recognize, say, certain cravings or certain things that come out, maybe there's something going on that we need to explore, whether it's to try something or to take something out. But this is where it's individualized and personalized. And you're absolutely right. Like, what works for one person doesn't work for another. And this is really the movement of modern medicine now, is we are moving much more into a targeted, individualized precision space. And it's a really exciting time to be in this area of research, to see more of this sort of precision therapy start to come into practice.
Yeah. Well, you mentioned holy basil was in one of your ResBiotic products. And I think holy basil, I have the tea, and I recently did a
Love.
reel, and it was about removing fluoride from your water. And it removes fluoride from your water, which is really cool. So
Yeah.
can you explain more about holy basil and why you wanted to include that?
Yeah. So holy basil, I mean, it has tons of benefits, even when you look at like turmeric. And so really it comes down to, it's a great adaptogen, right? And so I love adaptogens in that they can adapt to things in the body that are needed. But holy basil has really profound immunomodulatory and antioxidant properties. So immunomodulatory meaning supporting the immune system in healthy immune responses. So when we're taking things in that could be impacting how our immune system is responding to it, using things like holy basil helps to support a healthy immune response. And of course, those antioxidants support the immune system, support everything from, inflammatory signaling to mitochondria. So I think it's just a very potent herb that has multiple benefits. And so that was part of why we included it, is because it's adaptogenic, it's immune supporting, it's got incredible antioxidant properties.
Yeah. Well, I also remember you had you did mention, I don't want to say kind of mentioned, but you did mention something about GLP-1. And I know that's really hot right now, and a lot of people are against it. A lot of people are for it. And are you coming out with something to support GLP-1? Can you give me some insight on that?
Yeah. So at ResBiotic, we're very much focused on what I had mentioned earlier on, this gut X axis, this idea and this understanding of our microbiome as a foundation. And we have all these different axes. So we just talked about the gut lung axis, but we also have gut metabolic axis, where what's happening in the microbiome, because our microbiome produces different hormones and peptides that impact appetite and impact satiety, impact cravings, impact everything from blood sugar regulation. If you have dysfunction in the gut microbiome, you're potentially impairing those processes. And what most people don't realize is GLP-1, which is a natural hormone that helps support blood sugar regulation, helps to promote feelings of fullness, so supports appetite. But GLP-1's produced by within the intestines, by the intestinal L cells. So a lot of people don't realize that. So if you have a dysfunction in your gut microbiome, you're impairing and impacting how much GLP-1 your body's naturally producing in response to food. And so the microbiome is very much a target of that, because your microbiome is impacting the health of your GI tract and beyond. And so we came out with our ResM GLP-1 postbiotic. So we mentioned postbiotic. So this is a a bacteria that has retained some metabolic activity. This is an L. plantarum. And so in that inactive form, it's supporting the production, the natural production of GLP-1. And then we also combine fenugreek and white mulberry, vitamin D, as well as chromium. So other blood sugar supporting, appetite supporting components to increase that bioactivity and efficacy of it. So really looking at improving the conversation that's happening between the microbiome and our metabolic health.
Okay, so you haven't created a second Ozempic or anything. It's not that. It is, what is it? Because I don't want people to confuse it with, oh, this is just another Ozempic pill.
No. What I love about this is it's enhancing your own body's natural metabolic processes. And so one of the things that has really come to light with the GLP-1 medications is how many people are struggling with weight and blood sugar dysregulation. And I think about this, I mean, this is just an example of so many of the patients that I've worked with that are eating well and exercising and can't lose weight. That's really where we have to think about the microbiome. That's really where we have to start to think about what's happening there is actually impeding and impacting our results with all these other efforts that we're trying. So this is not GLP-1. That's a synthetic hormone. You're taking the GLP-1 medications, you're taking GLP-1 at 1,000 times the natural dose that your own body's producing. This is to support your own body's processes, which in fact, research has really shown that if you can help improve the microbiome and the health of the microbiome, that we can actually achieve more long-term sustainable results when doing other weight loss efforts. And it's because the microbiome has such an impact on our success when it comes to different weight loss interventions. And so it's just natural components that supports that natural production. So what we've seen with it is improved appetite. So feeling fuller longer, reduced cravings. We actually just launched a clinical trial that we're running right now, looking at various metabolic biomarkers. So looking at hemoglobin A1C, which is a 3-month average of your blood sugar, looking at changes to satiety, your appetite, looking at GLP-1 production. And so that's really exciting that that clinical trial is underway so that we can really start to see. We've done some in vitro and some assaying that has shown lots of positive benefits, but our clinical trial should be wrapping up hopefully in the next few months.
Okay, so your product, what's the name of it?
It's called
GLP-1.
Yep, it's called ResM GLP-1 Postbiotic.
Okay, because I want to make it clear. So it's making your body produce this on its own.
The natural production of GLP-1, which our body produces. It's produced by your intestinal L cells within the GI tract. And so if we are not producing it, and this is one of the things that, I like to talk about, especially in people that are using GLP-1 medications, is if we have desires to stop, to transition off, if you're not doing anything to enhance or improve your own body's production of these natural hormones, then that's why weight regain happens, is because we're stopping something and maybe we've worked on some habits.
You didn't fix the problem on the first place.
And so that's why the microbiome is such an important piece to this, because these hormones and peptides are being produced within the GI tract. And so if we can enhance that and fix that and support that, then we're going to have more success. So it's not a question of don't take or do take, but improve your own body's natural processes, optimize your own body's metabolic health so that we can see more success in the long run, no matter what we do.
Yeah. I love that, going to the root cause rather than just putting a Band-Aid on it. Now, I always have concerns when I hear about people going on Ozempic is the side effects. Yeah. Do you know any side effects from this product that you have?
None. And that's what's exciting about it, is because we're taking natural components, no side effects whatsoever, except for the fact that people have noticed reduced cravings. People are noticing feeling fuller longer. So this is not something, if you're taking, GLP-1 medications, it's not contraindicated. You can take it together. In fact, I really encourage people to think about taking something like this, because even it might help with not needing to dose up as much. Like it might help some of that natural process that you're optimizing, especially if you have desire of transitioning off. This could potentially be a great adjunct to that in supporting that process.
Okay, so here's another question. Are there any tests that we can do to see if our GLP-1 is, at its optimal, and then also lung tests? How do we know if we even need these?
Yeah, great question. So number one is symptoms always. There's really not like a classical clinical biomarker or test to see what your GLP-1. We use what your blood sugar is doing, right? Are your blood sugars rising? Are you seeing changes in your blood sugar? We look at difficulty losing weight, appetite changes. I have so many patients that come to me, they were like, I ate enough protein, I ate enough throughout the day, but I'm always craving sweets at the end of the day. Increased food cravings is often a sign that there's a dysfunction going on in the microbiome, especially when everything else is controlled for it. Did you drink enough? Did you eat enough, right? Outside of that. So we look at more of those types of clinical biomarkers to indicate that changes to your metabolic health is also an indication that this is a microbiome problem. And that's why if we start to understand the relationship that the gut microbiome has to other conditions, it becomes part of that three-legged stool. We think about genetics, environment, diet. Well, microbiome is part of that same conversation. So in terms of whether or not do we need our GLP-1 postbiotic, if you're anyone who struggles from changes to your metabolic health, you're wanting to work on food cravings, you're wanting to see if you can feel fuller and be more, have greater satiety from the food that you're consuming. If we, for example, maybe we're not a candidate for a GLP-1 medication, this is a great option. But really anyone that's wanting to optimize metabolic health. And metabolic health is something that doesn't just present as weight gain or inability to lose weight. It can be everything from brain fog and cognitive changes to poor sleep to joint pain. I mean, this is
energy production.
Energy production, exactly. And I mean, there's been incredible statistics that have come out that only 12% of Americans are metabolically healthy. So 88% of us are not metabolically healthy. So I think this is something that many of us could really benefit from, to help to optimize our own body's processes without any side effects, without any, repercussions or any changes. I mean, it's a very safe supplement to take. For lung function, it's similar. Think about just, how does your breath feel? How deep of a breath can we take? But there are lung function tests that we can go to a pulmonologist. They measure things like FEV. There's different pulmonary testing that they can do to look at the, how forced, how forced, what am I trying to say? How well you exhale.
Yeah, I know what you mean because because of the mold in my lungs, I see a pulmonary specialist regularly. And so I went to get a lung test.
Function test when they're making you breathe into that forced expired air. That's what I'm trying to say.
It's basically, it's like you're breathing out air until you can't breathe anymore. And they put me in this this glass tube, and then I had to breathe through this little hole. And it was a long test actually. And so it was really interesting. And you breathe in like short little spurts, and then you breathe out one long spurt. It's really long.
Yeah, so they're measuring how much air we're exhaling, and that's actually something we measured in one of our studies. It's called FEV. That's why I was like having a brain fart on the.
I know it's hard to explain when you're when people can't see you.
Yeah, totally. The end of the day, we're jumbled. But again, I also think about how do we feel? Are we coughing? Do we wake up? We think a lot about our breathing during the night. Are we coughing so much that it's keeping us up at night? How much mucus production? So I always say so much of this is also based on symptoms and just how we feel.
What about post-nasal drip? I know you had briefly mentioned allergies and sinuses. I know that's more connected to sinuses, but isn't that also connected to your lungs?
Absolutely. And we've looked at, allergies and related symptoms. And that's why I say that reduction of, because again, post-nasal drip, you're swallowing it right? And so there's always a chance that this can impact the lungs. So yeah, I think it's an awesome thing to try. And anything that helps to reduce that mucus production for someone who struggles with a lot of mucus is really great. And that's something we saw in one of our studies. 98% of asthma participants would recommend our ResB lung support. 100% of the smokers that were in the study would recommend our ResB lung support probiotic. So it's exciting to see that, because unfortunately, when it comes to, say, smoking, the damage is there, and people suffer even if they didn't smoke for very long or they're exposed to secondhand smoke. So it's exciting that, we can offer something that's very safe and natural and also affordable to see really significant clinical meaningfulness out of a probiotic.
Yeah. And that's something that I am always an advocate for is, yes, I have healthcare, but I rarely use it because I'm always opting for alternative healthcare, which is not covered by insurance, unfortunately. So I'm always paying out of pocket anyways. And I'm like, why do I even have this healthcare? Like, of habit, just God forbid, like I'm in a car
Yeah.
accident or anything,
Insurance.
right? Right. It's insurance. But like, other than that, like I am just going for other options because I don't want to be stuck on a pill forever and just put a Band-Aid on things.
But even if you have to take a pill, I mean, that's why I say it's exciting now. Even if you have to, it's not to feel bad, but there are things you can do to support your body, to optimize our natural body's processes, to improve those processes, even if you do have to. I mean, I used to tell my patients that all the time, like, we have medication. This is the beautiful thing about integrative and functional medicine. And the use of these is we're really bridging that, all or nothing, right? We're in the middle of saying, sometimes you need these things, but we can also improve our body and do all these other supportive mechanisms that have profound benefits.
Yeah. I mean, I'm definitely not anti-medication.
No, I know.
I've taken my fair share and it's been life-saving at some times, you know, and I'm so glad it was there for when I needed it. But
of course. And I think now we're really in a day and age where we have a better understanding of how to support things from a whole body perspective. Whereas when you think about medicine and more allopathic medicine, it's very systems based. You have cardiologists who just focus on the heart and pulmonologists who just focus on the lungs. And I think that integrative medicine, we really put the whole body together and think about how each of these systems talk to one another. And that's why I think the microbiome is such an exciting space, because it's really at, really truly the gateway and really at the foundation of how all these systems talk to one another.
Are there any lifestyle things that we can do to improve our lung function beyond just diet?
Absolutely. Exercise is one of the best. Exercise, just getting out. Even, I think a lot of people think about exercise. Well, it's like, oh, if I'm going to exercise, I need to go run. But the benefits that walking has, the benefits that getting out for a brisk walk, not just on our lungs, but on our metabolic health as well. I'm also a huge advocate of deep breathing exercises. So anything we can do, and that has supportive mechanisms for our microbiome, for our brain health, but also our lung capacity and our lung function. So if you're into yoga, doing things like pranayama and deep breathing exercises are really profound. And if we are struggling with any type of lung dysfunction, that really needs to be part of, a whole person or whole body plan.
What
and I
about
think
steam inhalation?
I know like in some ancient therapies, there's a lot that talks about steam. Like, I mean, I go to like the Korean spa a lot and there's a lot of mugwort that you're breathing in. Not something that I have a ton of experience with. So I don't want to speak to something that I'm just not super familiar with. But I know there are people that recommend that. I mean, I think steam in general, especially when you're feeling really stuffy, can be helpful because it can break it up. But I always say work with someone, especially if you're putting any type of herbs or anything else in there, work with someone who's obviously more familiar with it. But I think steam is great. I think, all these modalities are really important when incorporating different interventions that you're trying to improve upon your health. And so,
Oh, what's next for ResBiotic? What do you see?
so we're in a really exciting time at ResBiotic. We have a lot of growth that's going on. We've just opened up, to healthcare practitioners. And so we're speaking directly to healthcare practitioners now and really trying to get out our science. We're a science first company. We are creating products using the same type of development that goes behind pharmaceutical products. And it's really because our founder comes from, a very deep medical background. And so all of our products, we do in vitro and ex vivo testing, and then we follow everything up with clinical trials. So it's really exciting to be a part of a company that is so focused on science and generating data that is obviously not just showing efficacy of our products, but really helping to improve the scientific literature surrounding these topics. But we have some really exciting products coming down the pipeline that are targeting other systems. We're looking at systems like women's health and joint and bone health, and we're looking at various ingredients related to that. So it's an exciting time for us as we're really growing.
When you say joint and bone health and things like that, is it a probiotic for joint and bone health?
So we are in the biotics space. So we're using variations between probiotics, our postbiotics, our prebiotics. These are all our own proprietary strains. And so what goes behind our testing is the strains that we have. We're doing functional analysis, meaning what systems are these individual strains or our postbiotic targeting that we can then create very efficacious products from. And so they're all targeting the microbiome to improve this gut X-axis.
Wow, that is so amazing. I can't wait. I'm going to have you back for that because I know so many people suffer with joint health and all of that. And it's just unfortunate. Everyone's on their phones. They're holding their phones. Everyone has, what's it called? Tech neck now?
Yeah, the kyphosis. Yeah, where they get that little hump in their neck. Yeah.
Oh, it's so bad. Okay, I do have another question. If someone is currently taking a probiotic pill, is it okay to include yours or should they only take one or the other?
That's a great question. And this is really what I'm passionate about teaching. And this is really why I think we have to treat the person and not just the condition or the issue or symptom. We can absolutely combine probiotics. And in fact, that's how you're really going to create a personalized plan. When we are now that we better understand these functions of these specific probiotic strains, you can start to pick and choose the ones that you need to do for each patient. So if you're taking, let's say, a general probiotic, you can take our ResB lung support probiotic. I generally tell people to take it at separate meals, just to not impact anything, especially when it comes to, how our immune system detects these things. I generally say to take it at separate meals, but absolutely. And I think it's very good to combine different probiotics because again, we're learning that specific probiotics have specific functions.
Okay. Do you think that it would be safe? Let's just say that I were to start taking this. Should I stop taking the current probiotic just for like a week to test the waters, or no? Just dive in.
No, not. What I wouldn't do is start two at the same time.
Okay.
Because then you have too many variables of whether or not you notice one improving something or not improving another. So if you're taking something, you've been taking it, just start taking this and see how your body does.
Okay. Great tip. Thank you.
Mm-hmm.
Well, thank you so much for just coming on and sharing your knowledge. And I am so interested in this. I'm going to look into it myself for my lungs, and I want to share it with my lung specialist. And
awesome.
That'd be great. Thank you so much. And I think we have a discount as well.
We do.
If you guys are interested in checking out ResBiotic, you can use the code DIGESTTHIS. So that's digest this, and then that should get you a discount, correct? Off your products?
It does. Yep. Digest this.
Okay, awesome. So you can go there. I'll put a link in today's show notes so you guys can easily access that. Thanks so much.
Thank you.
Thanks for listening to this episode of Digest This. If you enjoyed this episode, please leave a review in your podcast app to let us know. If you're ever wondering how you can support me and this podcast, sharing it with your friends and family is the best way. This is a Wellness Loud production produced by Drake Peterson and edited by Mike Fry. To check out more shows by my team, go to wellnessloud.com, and to email the show, message us at digestthispod@gmail.com. See you next time. The content of this show is for educational and informational purposes only. It is not a substitute for individual medical and mental health advice and does not constitute a provider-patient relationship. As always, talk to your doctor or health team first.
Are you looking to reclaim your health? Tune into the Real Foodology podcast, hosted by me, Courtney Swan, integrative nutritionist and real food activist. I am on a mission to transform our food system by challenging the corrupt practices that undermine our health and replace them with choices that genuinely support our well-being. Listen to Real Foodology podcast on your favorite podcast app. New episodes every Tuesday.